Nurses are asking the state to make it easier for them to do their jobs, but Governor Evers had reservations about it, vetoing a bill that would have eliminated some barriers for advanced practice nurses.
And advocates were back at the Capitol today making their push. Political reporter Will Keneally was there and explains what they're calling for here. Will.
That's right. So the barriers for these nurses, they need a relationship with collaborating physicians to do things like prescribe medicine. This restriction was eased during the pandemic, and advocates want that to become permanent.
Why am I now needing a collaborating physician again when I was good enough during the COVID pandemic?
That's the question advanced practice nurses are asking the governor, who vetoed a bill last month that would have made it easier for them to practice. The requirement for advanced practice nurses to have a collaborating doctor could be life or death for some.
I can be a day away from closing my practice if I were to lose my collaborating physician. Not only would this affect my patients, but it affects my livelihood and all the livelihood of my employees.
With the healthcare system shifting out of a pandemic crisis standard of care, advocates want that to become permanent.
Rural Wisconsinites will lose the access if I cannot find a willing and financially affordable collaborative physician.
While the governor will pay lip service to these very professionals behind me and the other 90,000 around the state that he values the work that they do, well, his actions don't match his rhetoric, because when he vetoed this bill, it was essentially a slap in the face to all the nurses that have provided great care in this state.
In his veto message, Evers said not all of the concerns of the medical community were addressed. Groups like the Wisconsin Medical Society opposed the measure over concerns that it would eliminate doctors from the equation of patient care.
But rest assured, even though this is a minor setback that the bill was vetoed, this bill is not going away. It will come back in some form or fashion next session, and I am hopeful that there will be an administration that will sign this bill into law.
And so, as he says, this could all change as Republicans look to unseat Evers in the fall.